Hello everyone. Today I'm going to talk about how to deal with a situation or how to deal with a case properly. So first of all, the most important thing is you have to read the case very carefully. Most of the time, what happens is you do have an idea of the previous case which was in the exam. So you are thinking that you will get the same case this time. But you have to be very careful. You have to read the question very carefully. Um, I have taken a recent exam question, so I'm going to address this question. So in this question, it's about missing renal biopsy. I'm pretty sure you must have seen this case so many times, but always read the question carefully. So I have modified this question a little bit. So in here, you are a FY2 in the GP clinic, right? So 56-year-old Sarah Clark come to trace the renal biopsy report. So biopsy was done in the hospital 1 week ago, and the biopsy report is missing. So what you have to do is you have to explain the situation to the patient and you have to talk about another biopsy, right? So you have to be very careful, because if the case is given in the setting where biopsy was taken, this would be a totally different management you have to talk about. So since it is a GP clinic, you have to keep that in mind very carefully. And then let's look at this question in a holistic manner, right? So in this particular patient's renal biopsy is already taken. So that means one doctor has already assessed this patient properly and have came to a certain diagnosis that came to a certain point where to get into the diagnosis you need a biopsy. That's why the biopsy has been done, right? So when you take the history, right, don't go in depth for the differential diagnosis, because that point you will be wasting a lot of your time for an unnecessary thing, because you don't need differential diagnosis because this is somewhat confirmed case, right? So what do you want to gather in this history? Obviously you can ask about the current symptoms, but don't go in depth, right? You can ask how this if the patient is complaining of frothy urine, how the frothy urine is, and if there is hematuria or any other things, you can ask about that, but don't go in depth, right? And you must always don't miss to ask about the previous renal biopsy. Because why do you want to ask about the previous renal biopsy? Because you are going to take another biopsy. That's the whole idea of this case, right? You want to make the patient to believe that he is willing to go for another biopsy, right? For that, right, you need to identify what are the problems that the patient has faced during the previous biopsy, right? So he might have to wait for a long waiting list in the previous biopsy. So you have to identify whether he was in a long waiting list, right? So that in this situation you can address that problem, right? Maybe patient was in severe pain during the biopsy. So you, in this situation, when in the management, you can address that. We'll talk about it in a while. So in addition, maybe the patient was having vomiting or any other problem during the biopsy, right? Or after the biopsy. Or maybe patient has some leave issues, right? So he underwent a biopsy, so he had taken some leave. So again, you might have to talk about taking another biopsy. So again, the patient might have some leave problem. So you may have to address it. So you have to ask about that, right? The patient's occupation and how this has impacted. So remember, these things are extremely important. So rather than spending a lot of time in talking about the differential diagnosis, which is not necessary in this case, you can ask about these points. These points are extremely important for your management, right? In addition, when you think about this history, right, you have to talk a lot in this history, in the management. So you can limit the time that you spend for this history. So maybe you can finish this history within 4.5 minutes or 5 minutes, and so that you have a lot of time to discuss about the management, right? So when you talk about the examination, there's nothing much to tell. You can tell generally about the examination. And then when you go to the management, you have to think about this management in two arms, right? One arm is you have to the first of all you have to break the bad news that the report is missing, so you can use all these interpersonal skills, which I'm not going to talk about that in here, right? So then once you break the bad news, right, so then what you have to do is you have to address the issue of missing biopsy, right? So you may have to tell about the that you have to talk this with the hospital because you are not involved in this process, right? So you haven't taken the biopsy, it was done by the hospital, and the hospital has lost the report, so you are not involved in the process, right? So what you can do is you can tell Sarah, as you clearly know that I'm not involved in this process, so I don't have much idea what exactly has gone wrong and why your biopsy report is missing. So I would like to talk with the hospital and see and try to clarify where it has gone wrong. Right? Like that you can address. So if it is in the hospital setting, then you have to directly take the blame, right? But in the GP setting, you don't have to directly take the blame, but still you have to apologize and you have to accept the blame, right? Because in this instance, right, you have to say sorry to the patient because you are taking this responsibility on behalf of your team, right? And there has been clearly a mistake happen, so you have to apologize from the patient, right? And you can talk about the options which the patient can move forward with the missing biopsy, right? So you can tell that you are going to talk with the team and ask the team members to escalate that to their seniors, or maybe you can directly talk with their seniors and tell the matter, right? And you can talk about the incident form, right? And also if the patient is still not happy, you can talk about the complaint as well, right? So this is the part where you discuss about the missing biopsy, right? Don't forget there is another part for the question, right? What is another part? You have to convince the patient to undergo for another renal biopsy again, right? So how would you do that part, right? So first of all, you have to tell why this biopsy is important. So if it is, for example, frothy urine, so maybe to decide the treatment, you need the biopsy report, right? So you can tell that is extremely important. And in addition, you can address the concerns with the patient which patient had before, right? Maybe he had a long waiting list, so in this instance you can tell, okay, I'll talk with the hospital and try to get a earlier appointment for you, right? And then if the patient had pain, you can tell, okay, don't worry, in this time we will make sure that we will give adequate analgesia, we will give adequate painkillers for you, right? If there was vomiting or something like that, you can tell they can give something to prevent the vomiting, right? And sometimes patient might tell about the leave issues, right? So you can talk about that also. So that is what you have to, that is the way you have to look at this case, right? Most of the time people just say, okay, 56-year-old or so, I just took the history very well. I asked about all the differential diagnosis, but you have failed the case. Why? Because you haven't addressed the correct, or you haven't addressed what they are expecting, right? So there is a part they expect in the history. There is a part that they expect in the management, right? So you have to clearly see that when you go to the exam during the first 1.5 minutes, right? You have to read that case very carefully. That is why they have given you 1.5 minutes, right? Don't just by heart the case and try to present it, right? For example, if this is instead of GP clinic, if this is in the hospital, the total management would have changed. The way you talked about would have changed. But for example, if you have by heart this case and go there, right? Definitely you will fail the case because they know that you have by heart the case, right? So as we always tell, look at the case in a holistic manner, right? For almost all the people, they have more than enough knowledge to pass their PLAB 2, right? The main issue that they face is they don't read the case, right? They are not being smart. If you have not watched my previous video, right, where I talked about how you can pass 7 cases so easily in your PLAB 2, right? You can see this exam is extremely easy. You don't need much of a knowledge, but the only thing is you should be very tactful, right? On how to approach the case and how to deal with the case, right? Rather than just putting out the knowledge that you have. That won't help. You have to be case specific in this situation, right? Otherwise you can't pass this PLAB 2. You have to be very keen, very particular on the case that you have. You have to read each and every word in your case, right? I'm pretty sure more than 50% of people never read the case. This is renal biopsy case. I present like this. No, it's not the renal biopsy case. You have to be very cautious. You have to concentrate on what this case is and then present. Okay, so if you are interested, right? We do have some mock sessions, right? So I'll be conducting these mocks, right? This is very cheap when compared to mocks available in the internet, right? We do 5 cases for £10 and 12 cases for £20, right? So this is something you have to think. I mean, by doing these 5 cases, right? We can't cover a syllabus, right? That's so obvious. So what we are planning to do here is to give you the basic concept on how to approach a case, right? I mean, if you are coming for us for a mock, right? More than 90% you have already started a course and you have already completed a course and you have already participated to several mocks, right? So doing 5 cases won't make any change if you are not going to gather something new, right? So our main idea is to give a holistic approach, right? Give give make your mind in a way that you can see the case and you can address the case properly, right? The amount of knowledge you have inside your brain is more than enough to pass your PLAB 2. But only thing is make it in a proper way, right? Where you take the necessary portion of the history, necessary aspect of the history. You can't cover A to Z in the history. So you have to concentrate on keep taking the main focused areas in your history. Then only you can pass, right? Meanwhile, you have to add some interpersonal skills. Then you can easily score 4 points in the case, right? So if you are interested, feel free to contact us through WhatsApp, Viber, Imo, or even Facebook, right? You can find all the details later. Thank you. So, if you are interested, you can contact Dr. SES through WhatsApp, Imo, Viber or Telegram through +94761251662, or you can visit Dr. SES Facebook page www.facebook.com/smarties.org, and you can also visit the YouTube page where you can find some videos. So stay tuned to us and subscribe for more videos. Thank you.